Hi everyone. Today we are going to go over Unit 1, Foundations of Medical Surgical Nursing. So in this unit we will learn and cover critical thinking, concept maps, and clinical pathways. So we'll discuss each in more detail. So first off, what is critical thinking? So critical thinking is the use of knowledge, reflection, professional standards to provide a holistic care. So this is where nurses learn to look at a patient as a whole instead of just their illness. It's looking and treating that patient as they need to be treated, not just as the illness itself needs to be treated. So critical thinking is a process that is acquired. This is through learning and experience. It is used to help focus on the options for problem solving and decision making, rather than rapidly and carelessly adapting to different situations. It combines the nurse's knowledge base, experience, competence in nursing, process, attitudes, and standards. All of these combine to assist in making a clinical judgment that are all necessary for safe and effective nursing care. Data must be collected prior to the formation of a decision or diagnosis in order to provide adequate critical thinking for this patient. So how do we begin to learn how to critically think? First off, we need to include the patient in our decision-making processes. And we need to reflect on our past actions and our decisions. We do this to learn, grow, and adapt in our future care. We acknowledge when more information is required or when the information we have may be misleading. And then we need to recognize our own personal limits and when to seek help. So this includes our own personal biases and when and when not it is appropriate for you to care for that patient. So what are some tools that can help with critical thinking? Nursing process, care plans, or concept mapping, which we'll talk about later on in this presentation, along with clinical pathways. So the nursing process, this should all be a review for you. So if you do need a more in-depth review, you can go ahead and read this slide, but I will not be going over it. So concept mapping is the care plan that utilizes visualization to organize the relationship between the interventions and issues resolved. So concept map directs the entire healthcare team in the daily care goals to set for healthcare clients' conditions. Concept maps help nurses move beyond memorizing facts and focusing on tasks. It helps make links and form connections between problems or interventions affecting the same goal. So for example, if a patient comes in and they have COPD or chronic obstructive pulmonary disorder, and they are a returning patient, they come in every month, every 2 months for an exacerbation of their COPD. So a short-term illness where the COPD is getting worse. We can look at the patient as a whole. This patient may work in an area that puts them at risk for the COPD, or they may be a smoker, which can then exacerbate the COPD. So it's looking beyond just that illness and looking at what factors that patient has that may be affecting this illness, or how this illness is maybe affecting the patient's care and affecting the patient's life. So looking at everything around that. So concept maps are great tools to help us visualize that. So as I previously stated, concept maps help us visualize the nursing process. It helps us identify the patient's primary health concerns, helps us make links for diagnostic treatments and assessment data, supports the nursing process. They're fairly easy to learn. They can be pretty simple or they can be complex. It all depends on you and your patient, and helps develop that critical thinking. And there are many different ways to format. So I previously stated there are many different ways to create a concept map. Typically, the first step is placing the patient's name and the demographics in the middle of the page. The next step is working out from the center. Start by listing the patient's comorbidities and their assessment data. From there, we take on the assessments and the comorbidities and list how it affects those patients, or the interventions that are required for each of those. So your concept map may look something like this. Then we provide links. So for this one, the name or the demographics, the assessments may have 3 different interventions or 3 different assessments here, whereas this assessment is related to this comorbidity. I'll provide another example here shortly. So this is a spider concept map. So this is one that was taken right out of your textbook. So this one, as you can see in the middle, they have the patient's name, and then they have their demographics off to the side. So she is a 65-year-old woman. Her health history, they have it all linked in one area. She has asthma, which then causes difficulty breathing, which is caused by smoking and cannabis. She had to have her fingers amputated from frostbite, which then links pain, wound debridement, and infection. So everything that links together is touching. Whereas history of hospitalizations, pneumonia, and previous infections. These could also be linked to her health history. So pneumonia and infection, previous infection. Experiencing homelessness, so malnourished, intimate partner violence, loss of job. Again, these can all be linked to her health history and to her hospitalizations. So malnourished can lead to infections or pneumonia. Malnourished can lead to amputation. Loss of job can lead to malnourished. So there are more links in this concept map than what it does show. Here's a concept map that I did create based on Harpreet Kaur, one of your lab patients. So Harpreet Kaur is a fairly involved patient. She has a lot going on with her. She has a lot of comorbidities, a lot of medications. So this is just a very short or very small snapshot of her as a patient. This concept map in real life would be much larger, as it would incorporate and include a lot more information for Harpreet. But as I stated, this is just a very basic concept map. So I have her name in the middle, 78-year-old female, and then all of her comorbidities listed in a black box. From there, I've taken all of her medications and I've put them in the green boxes. And I've taken any other things that are important to her at this time and have linked them. So diphenhydramine, she takes it for an allergy. Her allergy causes a skin rash. She takes the nitroglycerin patch for angina and also for hypertension. For osteoarthritis, which could have led to her fractured hip, she's taking pain management for Tylenol and hydromorphone, and she did have a hip replacement. So everything is linking on here. So moving on to clinical pathways. So what is a clinical pathway? This is an interprofessional collaboration of different tools used to organize goals, monitor outcomes, and to provide the best quality of care to a patient or a client. So why do we use them? To serve as an interdisciplinary care plan, tools for tracking the client process towards achieving positive outcomes. They decrease the hospital stays, which then in turn decreases cost. Develops for certain areas. So these certain areas, such as OH&S, high-risk patients, elderly, or common health problems. So these can be very specific to your patient, but they can be very generalized as well. So clinical pathways are an expected pathway. We would like to see that patient with this comorbidity or this disease or this surgical experience to follow. So, for example, if a patient has had a hip replacement, we expect them on day 1 to be up and walking. On day 2, we expect them to be changing their dressing. On day 3, we expect them to be doing stairs. That is not correct. Do not write that down. But it just states, gives us an idea of what to expect on each day related to this patient. I will have the examples here coming up. So clinical pathways, they include a nursing care plan, daily interventions, and documentation. So these daily interventions, they can include any diagnostic tests that are important for that patient, any treatments, any activities, medications, consults, or education that are all important for that patient. So as nurses, how do we participate in clinical pathways? We need to participate in the development of that clinical pathway. And then we encourage the initiation of the clinical pathway on appropriate clients. So remember when I stated that clinical pathways are not only for nursing, they're for interdisciplinary team. So we're encouraging the interdisciplinary team to be part of this clinical pathway. And a part of that, we need to arrange. So we need to arrange when those events occur. We need to arrange and make appointments. We may need to arrange and make appointments for these patients. We then need to enhance or monitor the outcomes and document, of course. So how do we participate in the development of a clinical pathway? First off, we need to understand our patient and what their health needs are. And then we develop a care plan tailored to them. So this is a clinical pathway that AHS has adapted in the past. So this is from May 2023. I think this says it's too small on my computer to read. But it will tell you in the bottom corner when it was last updated and if it is still relevant. So as you guys know, the clinical pathway or the care of a COVID-19 patient has drastically changed over the last 4 years. So this just is an algorithm that shows the expected outcome for this patient or the expected pathway that this patient should follow. So after a confirmed or suspected COVID-19 patient with an established date of symptoms, so that is considered to be day 0. From there, we need to assess for any red flags. So on the real clinical pathway, all of these little tabs are soft tabs. So if I was to click on this, it would bring up another little image stating and telling us what the red flags are. And from there, we need to assess if the patient is high risk based on the antiviral eligibility. So if the patient is high risk, then we follow this pathway. If the patient is not high risk, then we follow this pathway. And just answer each step as it goes on. This clinical pathway is available on Moodle for you to go through, and you will then be able to click on those soft buttons to see the further information. So determinants of health. So this should be a review for you. So these are the 12 determinants of health that can be found on the Health Canada website. I can go over more of these in depth on an online session if you guys wish, but they should be a review for you. So after we have determined our patient's determinants of health and we have assessed our patient, it is time to develop a care plan for our patient. So again, this should be a review for you. If you want to go in more depth, please let me know and I can do that on a separate day. So some things to consider while we're caring for a patient to help with us in gaining and learning about critical thinking. We need to assess the patient's ability or their motivation to learn. So their emotional state. Mild anxiety can help a patient learn, whereas severe anxiety can hinder a patient's learning. Then other factors such as pain, hunger, or fatigue all play an effect to a patient's ability to learn. Intellectual. Do they have the cognitive abilities to learn? Their physical health, their height, their weight, their coordination, their sensation. All of these play factors on their ability to learn. Culture, their values and beliefs. and family. This is a big motivator in someone's ability to learn. And it is a very vital part for most people in their recovery. Family or friends will often need to know just as much as the client in order to assist them in their recovery. But of course, we are not able to involve the family of a patient if they do not wish that we do. So we need to get patient's consent before involving the patient's family. And ambition. Do they have a desire or willingness to learn? So the last step that we as nurses need to do while providing patient care is documentation. This is arguably the most important part of nursing care, as if it wasn't done, it wasn't charted. I know you guys have heard this in the past, but it is very true. Your documentation can and will be used as evidence in any legal event. And then some provinces use electronic health records. So here in Alberta, we use something called Connect Care. That is our form of electronic documentation, whereas Saskatchewan uses a different kind of electronic health system, and I believe other provinces do as well. So what is the best way to document, or how do we make sure that we are documenting enough for our patient? So if it does go into a legal dispute, we need to make sure that our patient is not only shown that our patient was properly cared for, but we are also protecting ourselves. There's 3 different acronyms that your textbook lays out for documentation. The first acronym that your textbook does state is something called SOAP. So this is the use of the subjective, objective, assessment, and then plan. So first you document your subjective assessment, your objective assessment, and then the plan for that patient. So what are you going to do? So this SOAP method is great, used to developing a continuing care plan. Then we have PI. So this is abbreviated for problem, intervention, and evaluation. So this is particularly good and useful when charting for a continuing care client or continuing monitoring on your patient. And lastly, we have something called DARP, which stands for data, action, response, and plan. So data is both your subjective and objective assessment. So DARP is kind of a mixture of the two. So it's using SOAP and PI. Personally, I don't know when exactly you would use DARP, but your textbook does include it, and I think it's fun to say, so I did include it on the slide. Your CLPNA registry body does have an excellent resource or an excellent module to help you learn documentation. So this is the link here for you to go and complete that module if you wish, just to help you learn more about documentation. So that is the end of Unit 1. If you guys have any questions, please feel free to email me at morgan.fisher@norquest.ca. Thank you.